Arthritis is a huge and sad problem in countless older dogs. It slows dogs down and it hurts. It can actually really detract from their quality of life. Unfortunately, we can't cure arthritis or even consistently prevent it. So let's talk about what we can do to hold it off for as long as possible and to make your dog as comfortable as possible if he or she ever has to deal with it. I'm talking about keeping them happy, keeping them healthy, keeping them having fun, keeping them being energetic. Let's get into how to make it happen.
And now, the vet who treats his sore joints with icing, Dr. Andy Roark.
We talk about arthritis like it's a specific disease, but it's not. Arthritis is a general term for joint pain or joint disease. Symptoms include pain, swelling, and stiffness, and decreased range of motion or mobility in joints. I see it most often in older dogs, and the owners say, well, she's just slowing down. Let me say this. Slowing down to some degree, it happens as we get older, but it is not a normal thing. It is not a given that as your dog gets old, he or she has to slow down. Often this is arthritis, and there are things we can do about it. Here are the 3 things, the 3 points of the Dr. Andy Roark trident for poking arthritis. The first thing we're going to talk about is weight loss, and that's for a bunch of reasons. Number 1, weight loss is the most important part of handling arthritis. It is the most effective path that we can take going forward. It is cheap. It's cheap to go on a diet, and it doesn't have any side effects at all. Just think about it. If you've got a painful joint, not having to carry as much weight with that joint, it's going to help. Just think about, you got 2 guys, right? You've got a skinny beanpole guy and you've got a sumo wrestler, and they both have bad knees. Who's going to be more comfortable? It's the skinny guy because he's not carrying huge amounts of weight around on bad knees. Same thing is true with dogs. Joints with less weight on them work better and hurt less. So let's get the weight off. The dogs that I see struggling with arthritis are almost always overweight. And here's why, okay? You are a happy dog and one day you hurt your knee. And so you don't play, you don't go and exercise like you did before, but you still want to eat and you're still hungry. So you eat the food that's given to you and you start to gain weight over time. And now when you try to get up, you've got extra weight. And so it's making that knee more painful than it was before, which makes you exercise less than you did before, which makes you gain more weight because you're not burning those calories. And it's a vicious cycle where the dog doesn't move around because they're overweight, and they gain weight because they're not moving around. And ultimately, I see these dogs, and the owner comes, and there's tears in her eyes, and she says to me, hey, I don't know if he has a life worth living. He doesn't do anything but lay around. He doesn't play or do the things he loves anymore. I do not want that for your dog. The take home here is that weight loss is key. We've got an episode on dieting for dogs, and I hope that you'll check it out. The big thing is, watch this vigilantly and make sure that weight gain is not making your dog's arthritis worse. When people have arthritis, one of the first things they do is reach for an anti-inflammatory medicine. Think of like Tylenol or ibuprofen or Aleve, or stuff like that. These medicines reduce inflammation and pain, so their benefit in arthritis is obvious. The problem is that these medicines have significant side effects, some of them even fatal, when given to dogs. If we want to use medications in dogs that are anti-inflammatory, we need to use ones that are specifically made to be effective and to minimize dog side effects. You get these from your veterinarian. They are prescription drugs. They are things like Previcox, Deramax, Rimadyl, Medicam, and there's a list that's growing. So you have lots of options. These medications can make a huge difference whether they're used daily or on an as-needed basis. Sometimes I start my patients off with just a short course and let's see how they do. And it's often because I want the pet owners to see the benefit and see how active their dog can be. People ask me about using steroids to reduce inflammation, and steroids totally work to reduce inflammation. The problem is that steroids have side effects, lots of side effects. They're hungry all the time, so they gain a lot of weight. That puts us back into our weight gain problem. They cause dogs to do things like pee all the time, lose hair. They've got a lot of panting all the time, and it'll drive you insane. There's side effects with steroids, especially over the long term, and that's why you don't see them being used to treat arthritis in dogs, just so you know. So what about the over-the-counter dog aspirin stuff? I hate that stuff, just so you know. I think it's got risk of serious side effects. I don't think it's very helpful. It just, to me, the benefits are tiny compared to the risks that you take. I really encourage you to avoid it. The big take-home point is that anti-inflammatory medicines can be a godsend. They can do a ton of good. You want to use the stuff that's specifically made for dogs. You want to work with your veterinarian to make sure that we're doing it in a safe way, minimize side effects, get all the benefits, minimize any risks or unwanted side effects. When vets talk about joint supplements, they're generally talking about glucosamine and chondroitin sulfate, although there are others worth considering. Glucosamine is a naturally occurring compound which may help increase production of joint fluid and also keep cartilage in the joint healthy. Chondroitin sulfate is supposed to protect and help repair damaged cartilage. It's supposed to inhibit enzymes that can break down cartilage and even help repair damage to the bone that's beneath the cartilage in the joint. So should your dog be taking glucosamine and chondroitin supplements? Listen, I'm just going to be totally upfront about this. This is a dodgy issue. There is data that conflicts all over the place. There are some studies that say, yes, you should totally do it. There's a lot of benefits for your dog. There's other studies that say, no, we don't see any benefit over just giving dogs a placebo or a sugar pill. It really is still out, and this is an area where we need more research to speak honestly and truly about, are there benefits or not. I have worked with pet owners that swear by the glucosamine and chondroitin that their dog gets. I have personally seen dogs that seem to benefit significantly in their mobility. Granted, I'm doing it when I'm coupling with it weight loss, and it's sort of hard to say, like, is this exactly the glucosamine and chondroitin? People that I have used it with, they have sweared by it, but for their pets. I have also worked with pet owners who have been like, hey dude, I did this for 6 months, 12 months. I can't tell that it's doing anything. And so I definitely have a mixture. One reason we might see these conflicting problems, it definitely makes the whole issue a bit more hairy, is that the FDA doesn't regulate nutritional supplements like they do medications. They regulate nutritional supplements more like special foods. So I'm not saying that nutritional supplements are going to be unsafe, but what I am saying is that you might get stuff that's really good, or you might get a supplement that is just total junk, and what is it supposed to be in the bottle isn't even in there. So that means you should only buy the really expensive stuff, right? No. The research that I've seen indicates that the price of the supplement is not tied to the quality of the supplement, and how cool the bottle looks also does not indicate how good the stuff inside is. So you've got a real problem of picking supplements that actually have the compounds that we want in them that are going to be useful to your dog. So how do you do that? The best advice I have is honestly to ask your vet what they use, because as a vet, I use a lot of this product. I send it out and say, these are the brands that I have had people come back and say, yes, this made a huge difference for my dog. If I have a brand on my shelves and people do not find value in it, it's gone, and I don't recommend it. Ask your vet if they have recommendations, because that is your best shot to get stuff that actually works for your dog. If you decide to add a joint supplement in to help protect against arthritis, know that this is a long-term process, and in the best case scenarios, it's going to be 4, 6, 8 months before you really see any kinds of benefits. Just know that going in, so it's not like, oh, I've been doing this 2 weeks and I'm not seeing any benefits. It takes some time. The other thing to remember is that you may not see significant improvement. That doesn't necessarily mean that the supplements aren't working and helping protect against damage that would otherwise be happening. And that is our show. Guys, I hope this is super helpful. Arthritis is a huge problem. I want to see your dog having fun. I want to see him or her playing and running and enjoying life as long as possible and as big as possible. So I want to nip this in the bud. I want to protect your buddy. I want to keep you guys out and active. Do me a favor, if your dog has dealt with arthritis and you found something that has worked and helped greatly, put it in the comments down below. Let's have a conversation. Let's see if we can help each other out. Help me grow the community. If you know somebody who has a dog that's struggling, hook them up with this video. Let's get them in. Let's see if we can help them. Let's help that dog. Let's help each other. Guys, until next time, let's be the people that our pets deserve.